Okay, so now we are to our featured session, Advancing Student Mental Health and Well-Being. We're very fortunate to be joined this morning by Laura Blake Jones, Dean of Students, Mary Jo Daypree, Director of Wolverine Wellness, and Amy Dittmar, Senior Vice Provost. So I'm going to turn it over to Laura, Mary Jo, and Amy.
Thank you, Betsy, and good morning, everyone. On behalf of my co-presenters, we are really pleased to be able to be here with you this morning and share some very exciting to us updates about important work that's been happening on campus. And want to frame a little bit in terms of why we wanted to be here with you this morning. We are excited to be with you and share this information, but we have the goal of hoping that we can ensure that you will understand the breadth and importance of this work and be able to begin a partnership with us because the work that we're about to describe to you and share is an institutionalized effort that is going to persist, different than what might be more typical here, where a committee meets and they come up with some recommendations and it gets put into play. In this instance, we are building an infrastructure for a comprehensive and institutionalized approach that will persist at the institution to allow us to continue to address the needs and concerns of our student, faculty, and staff populations in terms of mental health and well-being, and be able to connect the dots at this very decentralized institution, we hope in a way we've never been able to do before, to work to our common goal of becoming a health promoting university. And so the motivation behind this, of course, as you see on this slide, our students' growing mental health needs were evident to us prior to the pandemic, but certainly the persistent effects of the pandemic, the isolation that students have felt that all of us have felt during this time, and the difficulties we've had to overcome have exacerbated mental health needs. And additionally, growing levels of anxiety alongside what previously depression had been the #1 concern of college students in presenting for mental health treatment, but anxiety has outstrapped that. And additionally, the pervasive impact of institutionalized racism and the ongoing racism that we've experienced and white supremacy that we've experienced in our world, in our country, on our campus, puts an added layer of mental health need on our population of students of color. And so it was really important for all of these reasons that we come together and have a comprehensive and holistic approach to addressing the mental health needs of our campus population. And in student life, where Mary Jo and I work, we've been, and we have units whose sole focus is mental health and well-being inside student life. But we've been working on this problem for years. We've taken what Mary Jo will explain to you in a minute, a collective impact approach to doing this work. But what's unique about the way that we're doing this and the information we're going to share with you today is that through a committee that was appointed, we've created a cross-campus collaboration, bridging academic affairs, the schools and colleges, and student life in this effort. And what we know about collective impact and public health concerns is that you can only move the needle and affect change when you're working systemically across a large institution like ours. And so we're very excited today to talk to you about all of this. You can go to the next slide. So Amy, Mary Jo, and Heather is also here. These folks are part of our implementation team that is advancing this effort. Also on the implementation team are Todd Sevig, our Director of CAPS, and Will Sherry, our Interim Director of Strategic Initiatives in Student Life. And Amy and I took on the role of leading out the implementation team at the request of Provost Collins and Vice President for Student Life, Martino Harmon, after we had co-chaired a cross-campus committee that developed recommendations. And our committee submitted our recommendations to the provost and the vice president. We were hopeful that because we had built on the work of many committees and task forces that had come before us that had laid the groundwork for this work, that many of our recommendations would be accepted and resources would be provided. And what I'm really excited to say is that these 4 quadrants here that we're going to talk with you a little more about today all of the recommendations that our committee advanced were accepted, and the initial resources that we need were provided, and we were asked to form this implementation team while we're building the robust infrastructure Mary Jo will talk about in a minute to get the work started. We didn't want to wait to begin advancing work in each of these areas. And so what you're going to hear about from us this morning is the holistic approach, the strategic and comprehensive infrastructure, how we're going to transform our campus to be a campus where empathy, care, and compassion are evident and mitigate stress, how we can strengthen and coordinate the service offerings that we have, and folks oftentimes focus on the service offerings in CAPS, and justifiably so. That is a really important aspect of our continuum of care. But we have a far broader continuum of care and range of resources that are available for our students that we need to strengthen and coordinate across. And then again, our continuing challenge, and all of you as communicators on this campus know this, is that we have so much here, and we're often working in isolation in our various corners of the campus, but ensuring that the resources are coordinated, ensuring that students can find them when they need them, and that we're working in concert together is a big thrust of our efforts. And so now I'm going to turn it over to Mary Jo, who's going to walk you through this first quadrant and the exciting things that are going on.
Thanks, Laura. So the recommendation for a comprehensive infrastructure is really an acknowledgement that the intersection of personal and community well-being is always evolving, it's multidimensional, it's interdependent, and it can rarely be solved by task force alone because it changes over time. So it's hard to create sustainable change in that model. So we really looked at what could we use to provide sort of that guidance or that pathway to become sort of what you see at the center of this is as a health promoting campus. And so I'm going to talk to you a little bit about the Okanagan Charter because it is a guiding document of sort of the aspiration of where we want to get to. And then I'll talk a little bit about the how. So if you can go to the next slide, I just want to talk to you a little bit about the Okanagan Charter itself. The charter was actually authored in 2015, and it is an international charter. So the other thing I want to express to everybody here is that this is not just something at U of M, in the state of Michigan, that this charter really is a call to action for institutions of higher education across the globe. And I think the other thing that's really important about this guiding document for us is that it really is this positive, proactive approach beyond a focus on individual behavior. But Laura talked about the charter really talks about what are we going to do at systems and policy level to create this sustainable change. So the charter is, I think a couple other things that you'll see is that it also acknowledges that health promotion and well-being is not just the responsibility of a couple distinct units, that it must engage all sectors. So part of the reason I'm so excited to be with all of you today is that it helps us get the word out, that people can see themselves in this. The other really important thing about the charter, as you can see, is it looks at really taking a stance in favor of health, equity, social justice, and sustainability for all. So when you think about some of the work that we're doing at the University of Michigan, right, how do we start to thread those together and really shift to this health promotion culture? So the next slide really is the how. How are we going to do that? And so I just want to talk a little bit about the collective impact infrastructure that Laura gave voice to. So the first thing I want you to know, it's an evidence-based framework. So a lot of times you hear words and you're like, oh, this is the new. I just want you to know that this is an evidence-based framework that was first described by Kania and Kramer article in the Stanford Social Innovation Review in 2011. It is a framework used to address complex social problems. Its innovative structure really looks at engaging the entire community, and it works across sort of silos. It is, and it really is, the goal is sustainable change, right? That really is the thing. A couple other things that would be important for you to know is that the framework places equity at the center of how we do the work. And I think that when you think about that, what does that mean? It's like, how do we intentionally elevate voices that don't typically get heard? How do we engage across typically silos that don't always talk to each other? And so what you see here in the slide in front is sort of what that infrastructure is going to look like. And we are in the process of building this right now. A couple things I just want to say is that this infrastructure and the collective impact infrastructure is not to sort of take over individual units programming or anything like that. What this infrastructure really is to do is to take it up a level and look at systems level policy approaches. Give everyone at the institution a common agenda or a common language of where we're headed. There are mutually reinforcing activities and metrics that will follow, and we will continuously communicate with the entire campus community about this work. The other thing I think that's really important to note is that students are going to be part of this in an ongoing way, not an add-on. So I think that's also a really important thing to note. And then if what you'll see on the slide is sort of the infrastructure that we're building right now. And what you can see on the steering committee where it says members, diverse staff from across schools, colleges, and student life areas. You'll see an advisory council. That advisory council really is going to help us be sure that we are using sort of the state-of-the-art research at the institution and the state-of-the-art institution around the globe in terms of how we build this. And then what you'll see, and you'll hear a little bit more about, is some of the individual work teams that we stood up already as a result of the report. And those work teams may change over time as the infrastructure gets built. And I think I'm going to hand it over to Amy.
Great, thanks so much, Mary Jo. As I get into thinking about all the things we're going to do, I just want to reflect on, Mary Jo's given this kind of nice holistic review of what we're doing and the how. And so the next couple slides are going to walk you through a little bit more, coming down a little bit on the what we're going to do. And as we do that, I think what you'll see, and I want to highlight, is the partnership between the academic enterprise and student life. And so it is very purposeful that I am a part of this along with student life. And as many of you know, across campus, those partnerships don't always happen. And this has been a really great partnership. So I just want to highlight that as we go forward. So the first or the second box, but the really kind of first set of things that we're going to be doing is thinking about how do you create a culture of empathy, care, and compassion as you're delivering all of the mission that we do here on campus. And so this isn't about changing the commitment to excellence, but as we approach the students, as we work with the students, how can we improve their well-being as they're achieving their goals? And so in order to do that, we've already started and already implemented a number of things. So there is, starting actually in fall 20, we had a pilot with first years, and we've now expanded that to first years and continuing students to have a resource navigator program. And what that does is to make sure that all students have something outside of the classroom, that they're engaged with other students, that they're involved in a student org. So if a student has no other connections, someone just reaches out and says, hey, do you want to sit down and talk about what are some of the possible things that you could get involved in, or how's it going? And so it creates this personal connection for students that may not have found that personal connection yet in order to help guide them. And that's been going on now for 2 years and been quite successful. In the academic space, we have a whole team that's going to be working on reviewing different academic policies that might get in the way of students' well-being. So an example of that, you may have seen that this year coming out, or hopefully optimistically coming out of the pandemic, we've kept this add drop policy that was much more flexible that we had during the pandemic. Specifically for all undergrads this year, they can add or drop, well, they can drop a class till the end of the semester. And so that alleviated a huge amount of stress for students. LSA has actually adopted it longer term. The rest of campus is still evaluating what the right framing is in order to make sure it helps students balance their excellence as well as their well-being. But that's a good example of the types of policies that we're taking, where we're kind of reviewing and thinking about how we can improve students' well-being as we approach their academics. And the other piece we're doing is really working with faculty and staff who are on the front lines with students. We hear from faculty in particular, but also many staff that work with students that, they often have students come to them with stresses or mental health challenges that they aren't equipped to really know what to do. If I think back to my time when I was an associate dean, it seemed like the answer was always, well, welcome to CAPS. And sometimes that is the answer, but that's not always the answer. So really helping faculty have a broader set of skills that they can use in order to help the students. Next slide. And as we do that, that's going to kind of come into some of what we're doing in order to really flesh out and expand our offerings along the continuum of care. So when we say continuum of care, we're talking about everything from, kind of helping students on the front line, as I was talking about with the faculty, as well as all the way up to inpatient care that we often provide to some of our students that have the highest need. So if I wanted to give some examples here of some of the things that we're already working on, we've created a well-being academy, and that is doing really a host of different things to really help create these resources. Like I mentioned before, the compassionate care trainings for faculty and staff that are on those front lines that'll help equip them to be able to work with the students. That's one of the things that the Wellbeing Academy is doing. But it's also helping to develop and train a set of wellness coaches and develop resources for those coaches as well. So a wellness coach is someone that you might think that a student is having a struggle and it's creating a stress or a challenge in their life. They don't necessarily feel they need to go to a CAPS counselor or go into more of a therapy clinical situation, but they need some help just to navigate it. So it might be that they're really struggling in organic chemistry and they're having some challenges even thinking, what do I want to be when I grow up now if I can't do organic chemistry? And so that's the wellness coach is someone who can help walk them through that, help them figure out how to organize their life, how to figure out maybe how to find the tutoring they need, but can also help guide them if they need additional assistance with the stress and the anxiety that all of that's creating. So it's a coach for their life in that way. In addition to that, we've developed a new online peer support program, which is really, we've already launched that. We launched that in the fall, and it's gotten really great feedback already. Many students are participating, but we found in particular students from different identity groups have found it really useful because they can find somebody who they can relate to or going through similar challenges that they can kind of help work through that. And so that's another tool that we have to kind of help students along this continuum of care. As Laura mentioned, a part of that continuum care is kind of we'll call it the before and maybe beyond CAPS, but it's also CAPS. And so we often hear, and I'm sure you have heard in your own work when you talk to students or you hear from students that the wait times, it's so hard to get into CAPS and some of the negative feedback. And so over the years, we've invested a lot in expanding the resources of CAPS, adding more counselors, and we'll continue to do that as needed. But what we've done in this is to really step back and kind of think, so what's a better approach or a different approach to managing the intake at CAPS? How do we get students in faster to see someone, assess what their needs are, and maybe give them some tools and some assistance while they might be waiting for that first clinical therapy appointment? And so very similar to some of the well-being coaching that might be going on, but this is a little bit more kind of directing them to resources, helping them know about the peer counseling and such, and that will help them find the resources they need. And speaking of resources, our last box, and one of the big things that we're doing besides having people help the students find the resources is using technology in order to be able to find the resources on campus. Part of that is refining and connecting and improving our web-based resources, and we've already started that. That's some low-hanging fruit that we can work on. But the bigger, broader plan is really to use more machine learning and to think about having a platform that will use much of the data that we have to help students not only find the resource they're looking for, but find the resource that we think they need. So someone made the analogy of like Netflix. You go on Netflix and it tells you what shows or what movies that you might be interested in, even if you didn't know you were interested in it. And so we're working with a pilot with an outsourced company, as well as developing things in-house that will do that in an app for students. So going back to the chemistry analogy, you might put in tutor for chemistry, and it would tell you the Science Learning Center is, 0.2 miles from you and where that is to get your help. But it might also show you that there are wellness coaches or a peer support group or that is working through how to get through some challenges for pre-med majors or something of that sort. It would identify other needs and help direct students to that. So using some of the technology that you are all probably way more familiar with than I am, that's used so much in marketing, to be able to help the students as well. Next slide. So bringing this all together, I just want to highlight this holistic approach to creating the health promoting campus, ensuring that we continue to be on mission, the excellent educational place of University of Michigan, continuing to do everything we've been doing, but to think of the whole student as we're doing that so that they can really achieve their goals, achieve their successes in a nurturing, compassionate environment. And I think I'm turning it back to Mary Jo to go through a little bit more on how we're doing this and some of the work that we're doing with it. Next slide.
So I just want to bring us back to the initial work teams. I mentioned this when I was showing the collective impact infrastructure, but to remind everybody that these initial work teams were a direct result of what we learned through the Student Mental Health Task Force. This was what we heard. And so to get going, we assembled these work teams. And when you read the report, and if you read the report in detail, you will see sort of the context around each of these. And you heard us touch on some of these, so I'm not going to go over each one, but a couple of them I think are really important because you heard us talk about sort of the intersection of identity and well-being. And that work team really is being assembled to consult all of the work and provide tools that we make sure that we keep that at the center of how we're approaching things. And also to make sure that the voices of diverse students are considered and the perspectives of those students are considered as we move this work forward. Another one that I just wanted to touch on is the access improvement. You heard Amy talk a little about the initial access model, which is really an important and innovative new step in terms of CAPS. But the other thing that we're doing is there are more staff identified and funded to come on board. And then the next thing is really looking at that handoff between referrals. This idea that there's no wrong door, but that we make sure that we get students from referral source to referral source. So that access improvement work team is doing that. And then the other one I just wanted to highlight that we didn't touch on in other slides is that graduate professional student needs. We had an amazing Rackham Student Mental Health Task Force that also converted into a standing committee, and really taking that idea with this acknowledgement that our graduate and professional student needs sometimes are very different than our undergraduate student needs, and making sure that we have a work team that sort of puts that at its core and looks at some of the promising practices and the evidence-based approaches that are already on campus and seeing how to scale them up so that all graduate students and professional students can be incorporated into how we approach this work. So those, you heard a lot. The last thing I'm just going to do is just sort of give you a timeline, because there's been a lot of work that has been done sort of behind the scenes, and it's sort of coming out of the shadows, or the curtains are spreading and we're coming out. And so just sort of to tell you a little bit about that. I think the really important thing right now is that the backbone structure of that collective impact it is really in the formative stages right now. We got funding, as you heard, for many of these recommendations, and one of them is to have a health and wellness collective impact lead. so that there is a dedicated resource that will make sure that we build this infrastructure, the sustainable infrastructure to do the work that we talked about today. We are also going to be establishing the advisory council and the steering committee, and that will stand up this semester. And then I think the other thing that you'll hear more about is the expansion of a staff well-being network and the creation of a student well-being network. And that will be information that you're going to hear in the next few weeks to months about how we're going to engage people in those types of networks. So hopefully this gives you a little bit of a snapshot. And if I could sort of extend the timeline out, I think lots of exciting things to come.
Thanks, Mary Jo. And now I'm going to wrap us up before we open up to questions. But really, hopefully, this brief presentation from us has imparted the comprehensive nature of what we're trying to do, the sustained impact of what we're building to be able to continue to do, and the intersectionality of our DEI work, our climate, carbon neutrality, and our mental health work, because it is people, places, and planet coming together that will allow us to live into being a health promoting campus. And we knew, hopefully, if you're excited about what we've talked about today, we knew that a primary question on your mind might be how you might be able to help us. And so I'm sure there are more than these four bullet points that will emerge. But first, if you can, take the opportunity to read our full committee report and digest the content we've presented today. I know this a recording of this will be available if there's others you want to share this with. And we are working to build a comprehensive web presence for this effort. And we know we'll be pulling on many of you to help us think about that. We also know that in the framework for an effective collective impact strategy, the continuous communications that Mary Jo mentioned is what we need to lean on all of you for, so that we can ensure that in this very decentralized place that we're able to give timely updates and continue to engage people in the common agenda. And that'll be accomplished through communications and messaging. And then there's going to be these ongoing and incremental updates from our work teams that are existing now at the launch of the structure that Mary Jo's talked about, as we continue working with other campuses around the globe, living into being part of the Okanagan Charter. And so again, just widely sharing information. If we can count on you for that, it would be really, really helpful. And the final bullet here really is probably the most important thing. Collective impact infrastructure says that how you succeed is through mutually reinforcing activities. And caring about the well-being of our students at the University of Michigan is something that's happening across this institution in a myriad of ways. And so if we can connect the dots, and everywhere we go to give a presentation, we learn about 5 more things that are happening somewhere else, that we've been able to then reach out to those folks, not take over what they're doing, not try to change anything, but to connect it to this broader effort. And if we could count on all of you to help us with that, it will truly be transformative. So now I'm going to kick it back to Betsy, who I think is going to moderate some Q&A time.
Yeah, thank you very much. That's wonderful information, and this is so important. We've got a couple of good questions. One was about graduate students, so thank you for answering that in your slides. One question is, how do students connect to the online peer mentors? So very specifically, how would they know to go there, and how do they do it?
Jo, do you want to take that, or you want me to take it? Okay. So the online program that we launched is a program called Together All, and it's actually a third-party vendor that we're working with. And when we made that service available, there was an all-student announcement connecting students and letting them know of the resource. But again, if a student was paying attention on a particular day or saw it that day and didn't think they needed it, but continuing to message about the availability of that. And that is only one part of our peer services. So we have peer support groups in an organization called Wolverine Support Network, where people meet in person and online in a group format. We have individual peer counselors through CAPS. And then this new additive element is the online peer program through Together All. Anything you want to add to that, Mary Jo?
I understand there's an article about Together All on the CAPS website as well. Great. So question about how these initiatives are being communicated right now to the academic units, as well as to students and departmental staff and faculty advisors. Has anybody received any direct communication about this?
I'll start and then let others jump in. So this is one of many, many presentations we and others have been doing. So we have reached out to several student groups. We've talked with CSG as well as other campus leaders and presented there, as well as other advisory groups. We've gone out, and I say by we, it's a mighty team. Many of the people who were on the original report, that did the original report, half of those were faculty. And so they've gone out into different departments. So it's a big place. So obviously one by one, it's hard to have presentations, but we're getting out in a lot of different forums. And so we've gone to several schools, we've gone to several departments, as well as different student groups. In addition to that, obviously, you know, some of you have helped us with getting articles out and pushing that information out. But this is a part of what we're doing today, is having any information, anything you all can help us get this message out. I don't know, is there anything you'd add, Mary Jo? Or
I would just add that there was actually a national press release for the adoption of the Okanagan Charter, and that was on September 1st. The thing I didn't mention is the university was among the first cohort in the United States to adopt the charter. And so there was a press release, there was a record article mentioned in the daily, and there's a lot going on at the beginning of September. And so Laura used this term earlier about continuous communication. And so how do we sort of keep it front and center, I think is important. But those kinds of things were also done in addition to all the presentations Amy, Laura, and I, and others on the implementation team have been doing.
On a related note, there's a question about whether there's a website or a document that our audience can reference for all the resources that they should be amplifying to their communities. Sounds like that's a work in progress.
It is very much a work in progress. And so we do have documents that we can share. So when we send the slides from this presentation, we can send a few of the links to the foundational documents. But our hope soon is that we will have a web presence for this that will be comprehensive, that you could just send someone to the site and they'd be able to watch presentations that were recorded, but also see all the foundational documents, the current initiatives, and the measurable impact of what we're doing, right? So we're also building dashboards, as we learned about the effectiveness of that through our work in COVID, to be able to show and continue to evaluate what's making a difference. How many students have registered for all of the wellness courses that we're offering? How long right now is the wait time at CAPS? How many students have taken advantages of wellness coaching? And so we're building all of that. But the short answer is there's not right now one place we can send you, but we're working on it.
Well, thank you, Laura. A related question to that, you sort of hinted at this. How do we know that we're successful in this work? Dashboard one way?
Yeah, the dashboard is a big part of that. You know, one of the other places we've presented this was at the public regents, and they asked us the same thing. And so we are accountable for making an impact, and so we take that very seriously. So having the dashboards, coming up with some metrics. It's not easy to measure well-being, but I think we can have things that can correlate with that and help us see the progress. And so we have a number of different metrics that will not only be communicating externally, but maybe some that'll dig down even deeper internally so that we can know that we're having a real impact. So that's a key part of that last section, that last square that I talked about with the communication, the technology. I didn't mention it, but that's a piece of this as well, is working with our IT group to create metrics that we can measure ourselves both and share that, as well as internally measure ourselves.
Amy, the only thing I was going to add in addition to that is that part of the reason we chose the collective impact framework is that it requires shared measurement and the identifying of key performance indicators. And I think that's what we really had to have, is not lots of good work happening, lots of places on campus, but to identify and have the community identify what the key performance indicators are, and then constantly share how we're getting and how we're progressing towards those shared measurements. So it's also baked in to the collective impact process.
Thanks. I should also mention that my office and the Office of the Vice President for Communications will be working with you on a communications plan, and we'll be tapping our schools, colleges, unit leaders. So this will be a collective effort as well. So a lot more to come. And in talking with you separately about this, I understand that the University of Michigan is really in a leadership position in this work. That's evidenced by we are one of 7 universities to sign the Okanagan Charter. Can you say a little bit more about that leadership position and what that might mean beyond the University of Michigan, but for higher education broadly?
Laura, I'll start and you just jump in, and Amy jump in if you want. So I think what's really important to know is that there has been an international health promoting campuses network in existence since 2015. And the United States started a network 2 years ago. And that's called the U.S. Health Promoting Campuses Network. And I think right now there's it's 53 and growing by the day. And if you're part of that network, it says you are actively working towards the adoption of the Okanagan Charter. And so what was really exciting is that the University of Michigan was in a place where we could acknowledge that we needed an overarching infrastructure. And we were part of the first cohort to adopt the Okanagan Charter. So there are Berkeley adopted, Western Washington University adopted, all of the campuses that were part of that first cohort are on the Health Promoting Campuses Network. And the goal is that it's not just what we're going to do at the University of Michigan, but that we're actually part of a movement. In Canada, I think there's over 12 Canadian health promoting campuses networks. In the UK, there's a lot. So the United States is a little bit slow to the game, but I think what we're really going to see is many, many more campuses adopting, and then sort of developing the infrastructure of how that will look on their individual campuses.
And I want to highlight another way that I think that we're leading, and that is, again, this partnership across the entire enterprise. And so again, kind of thinking about both the academic enterprise and how you think about this all the way from the classroom through CAPS, wellness coaching, and you don't see that a lot on other campuses, and as you go around. And so I think that we've actually had other people really be impressed by that as I've talked to others on campus. And so I think that integration, which is core to the collective impact that Mary Jo talked about, is really another way that we're leading.
I just want to acknowledge, it has been a joy to co-lead this effort with Amy, and our colleagues at other institutions are like, how in the world did you get this partnership to be, where it is at this point in terms of academic affairs and student life working together. And when you have a leader such as Amy helping lead this effort and move it forward, who, by the way, is in charge of the university's budget, and I'm not in any way just saying, resources just flow, but Amy's understanding of this and advocacy to be able to fund the low-hanging fruit and the immediate things that we've done really shouldn't go unrecognized. So I just deeply appreciate that.
So another comment in the Q&A back to measuring success. This person is just suggesting that tracking the number of students who are taking advantage of the late drop add policy is also an indicator of well-being, and noting that students may never take advantage of the mental health resources, but dropping classes late in the term is a clear indicator of student distress. So just a note.
Yeah, I really appreciate that. And there was a big uptick this year with the drop from the fall. We saw quite a large increase. And we're still evaluating that to make sure that students have the right guidance as they're making those decisions as well for their academic future and for financial aid implications. But for the well-being, I think we're already seeing evidence of that.
Well, that does it for our questions. I want to thank you all very much for this important information. This is really great, and we'll look forward to actionable things that we can do going forward and being good partners with you in realizing your goals for this initiative. So thanks
Betsy?
to Mary Jo, Laura, and Amy. Yes.
One last thing, we switched away from the slides, but there was a final slide that directed
Yeah.
folks to Heather Gunther. Just because I know you may have additional thoughts, questions, ideas, and Heather is part of this group and is with you often. And we decided to designate her as the point person for this. And she, of course, will work really closely with us to get your questions answered and share information. So thanks again.
Thank you.